Okay, good morning.
Hi,
My name's Tucker. I'll be your student physical therapist assistant today. Can I have you confirm your last name for me?
Johns.
All right. It looks like you're coming in here with some left hamstring pain. Happened about 3 weeks ago.
Yeah.
Just playing soccer. What would you rate that pain right now on a scale of 0 to 10?
Like a 5.
5. Does anything make that worse? Does that pain go up at all?
Yeah, just like running, like anything like active really causes it to get worse. It gets to like a 7, probably.
Okay. And then anything that makes that better?
Just resting. Just
Okay.
been kind of taking it easy.
What does that pain get down to?
Probably like a 3 or a 4.
Okay.
Still kind of there.
All right. On the plan of care today, it's really simple. We're just going to do some heat. So it's a moist heat pack. We're just going to apply it right on that hamstring. I'll have you sitting. We'll just go for about 10-15 minutes, just kind of how you're feeling.
Okay.
It's just for a little bit of pain control. It won't have any crazy effects that you'll notice right away, but overall pain. There are a few contraindications and precautions I need to ask you before we do all that. But for that, I might be hands-on just a little bit to do a light skin test, a hot-cold test,
Okay.
and just palpate the pain area.
Yeah.
Do I have your consent to do all that?
Absolutely.
Okay, and then those contraindications and precautions, it's a long list, so I'm just going to rattle them off. Let me know if any of the following apply to you.
Okay.
Any recent or potential hemorrhage?
No.
Any thrombophlebitis?
No.
We'll check your sensation, but any impaired sensation that you know of?
No.
Okay. Mentation is good. Any malignancies?
No.
Okay, and then we'll stay away from the eyes, won't do any radiation therapy near or at the eyes. Any acute inflammation?
No.
Not pregnant?
No.
Any impaired circulation?
No.
Any poor thermal regulation?
No.
Any edema?
No.
Any cardiac insufficiency?
No.
Any metal in the area?
No.
Any open wounds?
No.
Any topical counter irritants?
No.
Okay. And then any demyelinated nerve conditions?
No.
All right, cool. So no contraindications or precautions, that's good. So I'm gonna start with you. Let's go up onto the table. You can just have a seat here. Actually, let's lay face down so I can get that pain area first, and then I'll do my skin checks. And it's the left side.
Yes.
Okay. You all right if I roll this up a little
Yeah,
bit?
go ahead.
Okay. Good. Right there is fine. Come around here. So I'm just gonna push onto your skin. Is it okay if I do that?
Yeah, absolutely.
I'm just gonna find where you're having that pain.
Okay. Like right there.
Right in here. Is it more on the medial side, or does it get out here,
More towards the center.
or towards the center? So
Yeah,
like
like
right in here.
Yeah, like right in there.
So right in the belly of that muscle.
Yeah.
Doesn't go up at all.
A little bit, yeah.
Okay, but more severe right in here.
Yeah.
Okay, so that hot pack will be good. We can cover that whole area. Next thing I'm gonna do is just a light touch test.
Okay.
So it's gonna feel like this.
Okay.
It'll just be a brief touch of my hand. You're gonna close your eyes or just don't look. Just tell me yes if you feel it.
Okay.
Okay.
Yes. 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 Yes.
Good. Okay, so this next test, you can stay right there, is gonna be a hot cold test.
Okay.
Okay, so I have a hot rod and a cold rod.
Okay.
Okay, so I'm just gonna place it on the skin. So I'll
Okay.
do it on your calf on this side real
Okay.
quick. So this is what that hot's gonna feel like,
Okay.
and this is what that cold's gonna feel like.
Okay.
Okay. So I'm gonna kind of same process. You're gonna close your eyes. I'm gonna place it. You're gonna tell me hot or cold.
Okay.
Okay.
Hot. Cold. Hot. Cold. Hot. Cold.
Good. All right. And I'm just gonna jot some stuff down real quick. Okay. And then I'm gonna do a brief skin check just to make sure there's no redness or anything like that before I apply the hot pack.
Yep.
Skin looks good. Not tender at all anywhere else, just kind of in that area of pain.
Yeah.
Okay. Cool. So I'm gonna go grab that hot pack. I will be right back.
Okay.
Okay, I got this hot pack here. What I'm gonna have you do is sit up for me. You can put your back up against that wall there. Just that pillow for you. Look around the side. Okay, so what I'm gonna do, I'm gonna have the hot part here, okay, and then there's gonna be 8 layers in between you and that hot pack. And what you should be feeling when I put this on is just, you won't feel anything right away because it's got to seep its way through the layers, but it should get pretty warm, but nothing uncomfortable or painful.
Okay.
Do you feel like, does your leg feel okay there? Because I can put something underneath too to kind of prop you up.
No, it's okay.
Good. Okay.
Yeah.
Are you comfortable like that?
Yeah.
Okay, so we're just gonna go for 5 minutes. I'm gonna put that bell there. I'm gonna set a 5-minute timer. Hit that bell if you need me for anything. I'm gonna come in 5 minutes, check the skin, and then we'll do another 5 minutes.
Okay. Sounds good.
All right, how are you doing?
Doing good.
Good? Okay. I'm gonna take this away real quick, pull it down here. Have you bend your leg up for me? Just gonna check the skin. Okay. It's not red. You don't feel any increase in pain or anything like that? Okay.
No. No.
Set this back here. You can relax there. Okay, and we'll go another 5-10 minutes. Just hit that bell again if you need anything.
Okay.
All right. It's time. How you doing?
Good.
Good.
It's warm.
Good. I'll take this away real quick. Check your skin one more time. Skin looks good. No increase in pain.
No.
Okay. And there's no redness or anything, so that's good. Set this over here for now. You can swing your feet off the side there. Okay. Do you do any heat at home usually?
I have like a plug-in, like an electric
it's like an
one. I
electric
haven't
one.
really used it though.
Okay. So when you are using those, you need to make sure they just have an emergency on-off switch,
Okay.
because they can get overheated,
Okay.
and if it just stays on, it can lead to burns. So just make sure it has that safety switch. If not, make sure we layer properly. So you need 6 to 8 layers. 6 if you're not laying directly on it. 8 if it's like how we just had it.
Okay.
So you can use towels are the best option, pillowcases, stuff like that. And you want to do that in like 10 to 15 minute bouts,
Okay.
and then wait 2 hours to reapply.
Okay.
Okay. Did you have any other questions for me regarding that?
No, I don't think so.
Okay. I'm just gonna get your pain levels real quick. What would you say your pain level's at now on that same scale, 0 to 10?
Like a 4.
4? Good.
Yeah.
So you had some decrease in pain. That's good. And again, wait those 2 hours in between, 10 to 15 minutes.
Okay.
Make sure you layer properly.
Sweet.
Okay. All
Sounds
right.
good.
Thank you.
Thank you.